Hi, I'm Sammy Millette, and today I'll be teaching you about Penicillin V. And I already went ahead and printed off the slideshow that you can go ahead and take home with you, and you can follow along if you like. Alright, Penicillin V. I even have an illustration of the chemical makeup of it. Alright, our population that we're talking today, you, adults. What the medication is. Now, Penicillin V is an antibiotic, a broad spectrum antibiotic. It's also an inexpensive antibiotic. I went ahead and had this illustration of what it looks like. You can recognize it by the E on one side and the 8-5 on the other. Why the client is being prescribed the medication. When bacteria builds up and causes symptoms of disease, we usually prescribe an antibiotic to destroy that bacteria and restore your body to a homeostasis and good health. How the medication should be taken. So Penicillin V, it comes in a tablet form, which can be taken orally, and it also has an oral solution if someone can't swallow solids. We do have that option. It works by killing bacteria. To be specific, it binds to bacterial cell wall and prevents it from forming correctly. And that what leads to the bacterial death and the elimination of it from your body. Now, it is important to note that even when your symptoms dissipate, you should still continue taking the antibiotics as ordered by your provider. Failure to do so can cause a resurgence of the same bacteria that you thought to be eliminated, but it will come back resistant to the antibiotic. Adverse and side effects to watch out for. So these are the common ones. You can have diarrhea, nausea, vomiting, abdominal pain. And I haven't seen it personally, but a black and hairy tongue. Now, some more serious side effects that you should seek immediate help for would be those of like hypersensitivity. So if you were to experience rashes, hives, itching, hoarseness, wheezing, difficult swallowing or breathing, swelling of your tongue, mouth, throat, you're experiencing an allergic reaction and should seek immediate help. One of the adverse effects that you may experience, especially in our elderly population as they're more susceptible, is C. diff. Since antibiotics kill bacteria, it also kills the bacteria in our gut flora, which is like a biome that helps with your digestion. When this gets all out of whack, there's certain bacteria, which we'll call bad bacteria, is allowed to grow unchecked. This leads to really bad diarrhea, liquidy, it's highly infectious. And the way that we can combat this is with probiotics, which is good bacteria that we introduce right back into your gut to keep in check the bad bacteria. So probiotics can be also found in food. The most common are fermented foods. This includes cheese, yogurt, kimchi, sauerkraut, pickles. You can also have probiotic medication, which is just these good bacteria in a capsule form. And that includes lactobacillus, acidophilus, and the others listed. And I have a nice illustration to help bring that forward. So these are the bad bacteria, what they kind of look like in a cartoon. And then we have the good bacteria. And then a good gut and an unwell gut. Contraindications. Apologies. Well, hypersensitivity / allergic reaction. If you are allergic to it, we will not give it to you. There are alternatives that we may find. If you have ever had Stevens-Johnson syndrome after a previous administration of penicillin, you should not again take it. If you are currently suffering from a C. diff infection, you should not take it. All right, moving on. Drug interactions. So, used concurrently with sulfonamides, erythromycin, and chloramphenicol should be avoided to the antagonistic effect. Basically, it cancels out the antibiotic you're using. Drugs like aspirin, phenylbutazone, sulfamides can increase the half-life of penicillin, making it act longer. Herbal interactions. It's best not to take any herbals alongside with it. You should take the herbals 2 hours before or 2 hours after as you take this drug. When you should call your provider. If you're having a severe allergic reaction, seek medical attention immediately. Just to reiterate how important that is. If you're experiencing abdominal pain, diarrhea, or fever, you should contact your provider and let them know of your symptoms. And this is some additional information I want you to take home and read over. If you do end up needing this drug, let your provider know anything about any of these drugs you're taking, any of these past conditions that you may be affected by. And it's a long list, so that's why I printed it out for you to take home. And these are our references. Thank you. You've been a great client. You've been a great audience.